Representative Debbie Dingell just did something that no member of Congress has done in decades. She read articles of impeachment to a cabinet secretary's face in the middle of a hearing. She held up a document. She said, "It's your impeachment article, sir." Then she listed the charges. You have abused your office. You have gutted America's public health. You have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You should resign. If you refuse, Congress should remove you from office.
Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office.
The target was Robert F. Kennedy Jr., Secretary of Health and Human Services. The hearing was about his record, and Dingell came prepared with facts. Measles cases spiked to the highest levels since 1991. Over 2,200 cases last year. 3 people died. 2 were children. During the same time, Kennedy questioned the effectiveness of the measles vaccine. His hand-picked vaccine panel voted against recommending the combined measles vaccine for children under 4. Over 90% of measles cases in 2025 were among people who were unvaccinated. In the first 3.5 months of this year, there have already been an additional 1,700 measles cases.
In just the first 3.5 months of 2026, the year we're in right now, we've already seen an additional 1,700 measles cases. I assume you're aware of this, according to the CDC.
There's a global epidemic.
Kennedy has pushed vitamin A as a treatment. Vitamin A overexposure among children increased by nearly 40%. Children in hospitals with both measles and unsafe levels of vitamin A have been documented. The CDC tried to slash the childhood vaccine schedule from 17 recommended vaccines to 11 before a judge blocked it. A 2024 study estimates that childhood vaccines have saved 1.1 million children's lives and prevented more than 500 million illnesses in the last 3 decades.
A 2024 study estimates that childhood vaccines have saved 1.1 million children's lives and prevented more than 500 million illnesses in the last 3 decades.
Kennedy's response was not a defense. He said the epidemic started before he came. He said he is not recommending unsafe levels of vitamin A. He did not deny the numbers. He did not deny the deaths. He smirked. Dingell called him out. Then Representative Andy Harris, a physician from Maryland, thanked Kennedy for his work on prior authorization and for protecting kids from what he called mutilating transgender procedures. He praised the executive order creating strict liability for providers. The hearing ended with a split screen. One member reading impeachment articles, another member offering praise. Let's watch.
Thank you, Mr. Chair, for holding this hearing, and Mr. Secretary, it is in fact true. I come from the great state of Michigan, and as you enter your second year as our nation's Health and Human Services Secretary, I just had a few things I wanted to tick through with you here today. So in early 2025, after your confirmation, measles cases spiked in the United States to the highest levels since 1991. Last year, we had over 2,200 cases in America. 3 people died, 2 were children. Do I have that correct? Because according to the CDC and the American Academy of Pediatrics, I do. During this same time,
that epidemic started before I came
during
into
this
office.
same time, you questioned the effectiveness of the measles vaccine. And then in September, your hand-picked vaccine panel voted against recommending the combined measles vaccine for children under 4. This is true?
It was dangerous.
We know
That
now that
particular
over
version.
90% of measles cases in 2025 were among people who were unvaccinated or whose vaccination status was unknown. That's correct? according to
You
the
think
CDC.
we should have given
it
a
is.
dangerous vaccine that all the
In
science said?
just the first 3.5 months of 2026, the year we're in right now, we've already seen an additional 1,700 measles cases. I assume you're aware of this, according to the CDC.
There's a global epidemic.
You have also pushed vitamin A as a treatment for measles. That is correct?
Yeah, every
According
major
to
health
the America's
organization in the world
Poison
recommends
Centers,
it.
vitamin A overexposure among children increased by nearly 40%, and in this time frame, children in the hospitals with both measles and unsafe levels of vitamin A has occurred, correct?
I'm not recommending unsafe levels. I'm recommending what every
The
major
Americans-
international health
Poison Centers-
organization recommends.
The American Poison Centers agrees. You characterized your response to one outbreak in Texas as a model for the rest of the world, even as the number of measles cases climbed. As Secretary of Health and Human Services, have you ever taken steps to undermine medical guidelines rooted in science? Because we can look at your record, sir.
Oh,
I serve on the Science Committee. At the beginning of this year, the CDC tried to slash the childhood vaccine schedule from 17 recommended vaccines to 11 before it was blocked by a judge. Hepatitis A, B, RSV, multiple vaccines were demoted. Do you dispute this charge, sir?
You think that we should recommend interventions
These
that
vaccines
have not been safety
have saved
tested?
countless lives. A 2024 study estimates that childhood vaccines have saved 1.1 million children's lives and prevented more than 500 million illnesses in the last 3 decades. Doctors, researchers, and medical experts have spent years working to not only understand illnesses, but also prevent them. Your actions restricting these vaccines have a grave impact on our country. And while you have waged war against established medical science, you've also attacked life-saving research on cancer and Alzheimer's. You have implemented measures that have raised costs, kicked families off their insurance, and made it harder to get coverage.
You're
And
just making
devastated
stuff
rural
up.
hospitals. Look, to top it off, Mr. Secretary, I got a copy of H.R. 944. Do you know what it is?
I
It's
can
your
Google it.
impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office. I yield back.
The gentlelady's time
question?
has expired. I now recognize the gentleman from Missouri, the good Dr. Under.
Thank you, Mr. Secretary. Thank you for being here. I'm glad my colleague got her little X clip there. Hopefully it'll go viral for her like she intended. Secretary, thank you so much for your work on just so many areas. But one of the things I wanted to highlight today was your work on prior authorization that was used too often to deny patients of the care they need. But I think what we're seeing, I'm a practicing physician, practice very little now that I'm in Congress, but now more and more we're seeing threats to patient access because insurance are allowing doctors to give patients the care they need, but then denying payment for those cares. And this isn't the usual, fight over physicians getting reimbursed. An example from my own specialty, I've been contacted by dozens of allergist immunologists around the country that United Healthcare is claiming to follow Medicare, dishonestly claiming to follow Medicare on allergy immunotherapy reimbursement, allergy shots, and completely denying care for that very life-changing, reimbursement for that very life-changing treatment. Given the market power of United Healthcare, this will put this particular therapy out of business within, I would say, 6 months to a year if UHC's policy continues, for 45 million United Healthcare insured patients. So I think we need to watch that, not only the barriers to care up front, but if insurers can arbitrarily use their market power to deny reimbursement, that care will go away likewise. But, yeah,
Yeah, I mean, I have children with anaphylactic allergies,
yes.
and some of them have benefited from these, these allergen
Yes.
medications. I have a son who literally lost his peanut allergy, which
Right.
every doctor told him
Yeah, that's oral
would
immunotherapy.
never happen.
Yes, that's oral immunotherapy, which is relatively new, and I don't think any insurer actually reimburses for that. But and then aeroallergen immunotherapy, pollen, mold, dust, and so on, that used to treat asthma, sinus disease, allergic diseases, is mostly what United right now is.
This is the first I've heard of it.
Yes.
So, and I have two guys who are sitting behind me, Chris Klump and Ken Callahan, who will be interested in helping you with this. Let's get them together with your staff.
I appreciate that, Mr. Secretary. And I want to commend you, and my colleague, Representative Miller, highlighted this, your work to protect kids from mutilating transgender procedures. Of course, I think most impactful, immediately impactful, was the denial of Medicare and Medicaid reimbursement to hospitals who insist on mutilating kids, despite the science, including the recent Finland study. But one thing that really just monumental development, I think, is the executive order that President Trump transmitted last January. It had a number of components, including directing the HHS study that came out later last year, but also directed the Department of Justice to work on a bill to create strict liability for those healthcare providers who would exploit our kids with mutilating transgender procedures. I am honored to be carrying that bill in the House. It's the Chloe Cole Act Senator Blackburn is carrying in the Senate. I believe that strict liability, the ability of parents and children, young adults, to hold those who exploited them with these mutilating procedures accountable, could be very impactful, just as we saw the AMA and the plastic surgeons change their position on mutilating procedures after the big verdict in New York. Do you think it's time that we be able to hold those who harm our children in this way strictly accountable?
It makes a lot of sense to me. The science is so clear that this is a harmful procedure with very little evidence of any benefits. We'll work with you on that.
No, I appreciate that. And the one talking point that these transgender doctors, I have a hard time even calling them doctors, but these quacks say is this is going to improve kids' mental health, prevent suicide.
Well, there's no evidence of that.
There's no evidence of that. And the Finland study showed that girls who are gender confused who undergo these procedures, their serious mental health issues double, and boys, they go up sixfold. So I think there's never been a good evidence, and now there's abundant evidence that we're doing more mental health harm than good.
I thank the gentleman.
Thank you, Mr. Chairman.
This hearing is a masterclass in how two members of Congress can look at the same witness and see completely different realities. Representative Debbie Dingell of Michigan saw a public health disaster. Representative Andy Harris of Maryland, a physician, saw a hero. The split screen is the story. Dingell came with numbers. Measles cases spiked to the highest levels since 1991. Over 2,200 cases last year. 3 people died. 2 were children. In the first 3.5 months of this year, there have already been an additional 1,700 cases. Over 90% of cases were among the unvaccinated. Kennedy questioned the effectiveness of the measles vaccine. His hand-picked panel voted against recommending the combined vaccine for children under 4. He pushed vitamin A as a treatment. Vitamin A overexposure among children increased by nearly 40%. Children in hospitals with both measles and unsafe levels of vitamin A have been documented. The CDC tried to slash the childhood vaccine schedule from 17 vaccines to 11 before a judge blocked it. A 2024 study estimates that childhood vaccines have saved 1.1 million lives and prevented more than 500 million illnesses in the last 3 decades. Kennedy's defenses were not defenses. He said the epidemic started before he came. That is true. The spike occurred after his confirmation. The trend line is not his fault alone, but he is the Secretary of Health and Human Services. His job is to respond to public health crises. He has not done that. He has undermined the vaccines that prevent measles. He has promoted unproven treatments. He has allowed his ideological opposition to vaccines to dictate policy. The result is that children are dying of a disease that was declared eliminated in the United States in the year 2000. That is not a political opinion. That is a fact. Dingell then did something extraordinary. She held up a document. She said, "It's your impeachment article, sir." She read the charges. Abuse of office, gutting public health, sacrificing medical research, making Americans less safe, children dying of eradicated diseases. She told him he should be ashamed. He should resign. If he refuses, Congress should remove him. She did not ask a question. She made a statement. She delivered a verdict, and then she yielded back. Harris then took the floor. He did not mention measles. He did not mention vitamin A. He did not mention the 1,700 cases this year. He thanked Kennedy for his work on prior authorization. He thanked him for protecting kids from mutilating transgender procedures. He praised the executive order creating strict liability for providers. He called the doctors who provide gender-affirming care quacks. He cited a Finland study that he says shows mental health harms. He did not mention that the study has been criticized for its methodology. He did not mention that every major medical association in the United States supports gender-affirming care for minors. He did not mention that the alternative to care is not no care. The alternative is suicide. The contrast is the point. Dingell sees a secretary who is killing children through vaccine misinformation. Harris sees a secretary who is saving children from what he believes is mutilation. They are looking at the same man. They are looking at the same record. They are seeing different things. That is not a failure of facts. That is a failure of consensus. The country no longer agrees on what constitutes a public health crisis. It no longer agrees on what constitutes medical care. It no longer agrees on what constitutes child abuse. The same policies that one member calls life-saving, another calls mutilation. The same official that one member wants to impeach, another wants to praise. Dingell's impeachment threat is not likely to succeed. Republicans control the House. They will not vote to remove a Trump appointee. But that is not the point. The point is to put the charges on the record, to say them out loud, to make Kennedy sit there and listen, to make the American people hear that a member of Congress believes the Secretary of Health and Human Services should be removed from office for endangering public health. That is not nothing. That is a warning. Harris's praise is equally significant. He is not a fringe figure. He is a physician. He is a member of Congress. He is a Republican. His support for Kennedy is not an outlier. It is a reflection of the party's platform. The Republican Party has turned against vaccine mandates. It has turned against gender-affirming care. It has turned against the medical establishment. Kennedy is not an aberration. He is the logical conclusion of a movement that has spent years questioning the expertise of doctors, the integrity of the CDC, and the safety of vaccines. Dingell is right to be alarmed. Harris is right to be pleased. They are living in different countries. They are governed by different facts. And they are both sitting in the same hearing room.